All right, thank you for the introduction, Emma. I'm Sofia, I'm a design strategist, and I've been working with digital solutions for almost 20 years and in lots of different types of industries. And during these years, I've learned that healthcare is a really, really complex area. And this speech is not about why and how healthcare is complex. That's for someone else at some other time, some other stage, I guess. But what I want to share with you today is that we need, if we're going to solve problems in healthcare, if we want to innovate in healthcare, we need an approach that takes complexity into account. And one of those approaches is design thinking. And design thinking and design is not about shapes and colors, form and art like a lot of people might believe. Design is really a process for innovation. And we see today that some of the most successful companies in the world are integrating design into their businesses. And that's something that we have to do in private industry and the public sector in order to try to understand the people, the users that we are designing the new services for. So today I would like to share with you a number of the principles behind design thinking and how they have helped me and my colleagues and the current team to try to change healthcare for the better and come up with new digital solutions within this space. And the first principle that I wanted to mention is that it's action-oriented, and that means that it's cross-disciplinary, learning by doing approach to problem solving. It's getting your hands dirty and experimenting, get out there rather than being an armchair strategist. So we can't sit in our offices and think that we can come up with solutions to problem by talking around a table. We have to go out and figure out what the context is like and what's going out there. And I wanted to share an example with you. So a couple of years back, we were designing for there is a project in Stockholm called 4D. It's a collaboration project between the Stockholm County Council and Karolinska Institutet. And me and my colleagues, we had the very, very interesting assignment to try to figure out why is the journey from symptom to diagnosis of rheumatoid arthritis, shortened RA, so long. And we did a lot of research, interviewed patients, of course, but also physicians. And in the early research, we had an idea that it's possible that a screening service online that patient takes online, learn about their symptoms, trying to figure out what their symptoms are, which might lead to a decision support that says whether it's likely or not that you have RA, that you take this decision support to your probably first meeting in healthcare with a primary physician in your first discussions with healthcare. And not only interviewing the patients, we also talked to the physicians about this idea. And they looked at us and they were really reluctant. They said, why should the patient come to me and with a decision support that says what their problem is? I mean, I didn't go like 7, 9, 8 years in medical school to have the patient come to me and tell what's wrong with them. That's my job. That's what I'm trained for. That's what I do. I do not just sign a paper and send a referral away to specialist care. And this was a very interesting insight because this is the reality. This is how a lot of people or physicians feel. And this was in 2013. It might have changed a little bit more with new digital services today, but this is what we have to take into account. And either we can say this is never going to work because the primary care physician is the first stop in healthcare. And if they don't want to use new services, we won't get anywhere. Or we can say that let's move on. Let's start something small. Let's start with a prototype, test it on them, and we will see what happens. And that leads us to the next principle behind design thinking, which says it's human-centric. It's always focused on the customer, or the end user's needs, including unarticulated, unmet, and unknown needs. So we were really designing a service for the patients, but we knew that the physicians are a very important stakeholder. We have to figure out what their needs are. And right now, they couldn't see any needs with this service. But it turns out that after a pilot study, when we come back to test again and discuss with them, how did you feel this period of time? We tested it for about 4 months. Patients would come in with this decision support and they would talk about the symptoms that they saw on this decision support. And we said, so how was it? And they said, it was amazing. Because usually we have 15 minutes with a patient and they can talk about so many different things. They have no idea what's really important and they don't remember the symptoms and they're not sure really what to tell us. And we try to kind of catch whatever they're saying and try to build a picture of what's going on here. But with this decision support, it took 15 minutes, 5 minutes to just go through the symptoms and say that, yeah, what we need to do now is to take a blood sample. We have to look for a number of biomarkers. And then they had another 10 minutes left in the meeting. And they said that we had a chance to show some empathy because they're usually really stressed, as you know. They have so many patients that they need to see, and there is not always room for empathy. But all of a sudden, they had 10 minutes where they could tell this patient that if it turns out that you have a chronic disease, you shouldn't despair, because the images that you might have of grandparents who have RA, where they're in a wheelchair, not being able to live a normal life, those days are kind of gone because research has come a long way. We have fantastic medications today. It's possible for you to live quite an ordinary, normal life. And what we saw here, that there were needs that the physicians had, but they didn't know them themselves. So we had to go out and test and try in order to catch these unmet needs and these unknown needs. Next principle that I wanted to discuss is that it reduces risk when we work with these processes where we start small and we test things. So whether it's developing and launching new product or device, there are many benefits from starting small and early failures. So this service that we're working with now, doing a lot of research for about RA patients, we've seen that there are a lot of needs that they have after diagnosis and living with a disease. And I've been interviewing patients around how we can support them today in their life. And I will show you at the end of this speech this application that we're building right now. But anyway, I had an interview with a patient last fall where she told me that she had stopped eating pork. And I said, all right, why is that? And she said, you know, I realized after a number of months that when I ate pork, my joints got more swollen and I felt more pain. So for those of you who doesn't know what RA is, it's a chronic disease that you have inflammation in your joints. You can't cure it. So medications is really for helping the patients to reduce the inflammations and so on, but you live with it for the rest of your life in most cases. So anyway, this woman, she told me that she felt that a lot better when she didn't eat pork. And I said, all right, are you really sure it's the pork? And she said, you know what? My sister, she also has RA, and she also stopped eating pork. And for her, it also became a lot better. And I asked her, so have you told your doctor about this? And she said, no. I can't tell the doctor about this. They would never listen to those things. And this is, again, very interesting because I'm also working with a lot of physicians, specialists, doctors, etc. And when it comes to food, there are very little validated research around how food and nutrition affects RA. And a lot of physicians feel that if they want to recommend their patient something, it has to be validated research. And when there isn't none, it's very hard for them to say, yes, you should stop eating meat, because they don't know what's going to happen to that patient. That patient might not get enough protein, and they're worried that maybe they get an unhealthy lifestyle from eating the wrong food, and maybe they will get worse in the end. But the thing is that patients who get, or a lot of people who get RA, also a lot of physicians tell me that the first thing that they ask about is food. What can I eat, or what shall I not eat in order to feel better? So we thought maybe it's not a problem that you stop eating meat, for example, if we in the same picture also can show that this person is exercising, this person is eating other things that are good for you, that has protein, this person has a positive emotional well-being, this person is not losing or gaining unhealthy weight. We have to start to gather data in a way so we see what one item like stop eating meat actually has, what effect it has on the patient. Because if the patient feels good about that, if that makes them feel better, maybe they should be allowed to go on with that. So starting small, when you're in these controversial areas like food and chronic diseases, if we start small, we come up with a small solution, we test it, we will reduce the risk of also giving the wrong advice to the patients, but also the risk of creating huge applications that might not fly because the physicians will not recommend them. Next principle that I want to talk about is that you need to be comfortable with change. So design thinking is disruptive and provocative by nature because it looks at and it promotes new ways of looking at problems. And that also means that it promotes new ways of solving problems and coming up with new solutions. And Jesper was talking about Parkinson's disease before and the fantastic research that they are doing. I'm not sure if you know this woman. It's a wonderful woman called Sara Riggare. She has Parkinson's. She doesn't call herself a patient. She says, I'm impatient. And she does a lot of experimenting and innovation, trying to figure out how data can help people with Parkinson's disease. Look her up if you don't know who she is. She's wonderful. And I borrowed a picture from her own homepage where she very, very clearly describes the red little dot up there. Those are the hours. That's actually only 1 hour per year that she's meeting with her neurological doctor. All the other blue dots, that's when she's in self-care, and that's about 9,000 hours per year. So right now we're focusing a lot on healthcare and new solutions maybe that are targeting that red dot, but we need to open up and create new solutions that are targeting all these blue dots. And that is a little bit difficult, again, because it means that healthcare providers have to change. So this application that we're building right now, I discussed the application with a nurse the other day, and she told me that, you know, you're helping the patient to collect a lot of data on themselves. They will have a story to tell when they come and meet the physician in the red little dot. And we're not used to that. We're used to giving information. We're not so used to listening to what the patient have to say about themselves. And this is a big change. And you have to be aware of the fact that it's going to also take some change in our among us for this to work, because if the patient collects a lot of data and a lot of information and want to tell their story and no one listening to them, they might also be disappointed. And again, we have to start with something small. We have to go out there and start testing and see whether this works or not. And in a kind of nice pace, fairly quickly though, we will change the mindset of people that patients will have a lot of knowledge about themselves that they want to communicate. But what we also need to see then is that all these blue dots have to be meaningful to them. So even they don't tell the story to the patient, the services have to meet their needs. And the last principle that I wanted to talk about is that design thinking integrates foresight. So without imagination of the future, the strategic process is dead in the water. Foresight opens up the future and invites us to explore uncertainties. And I think in healthcare today and in life science, we talk a lot about data. And it's also, again, kind of controversial because we know there are so many regulations around data and how we can use it. And a lot of people who want to be innovative also feel that we are limited by regulations and rules around data. And again, we have to start small. We have to start looking at how we can use data in healthcare, take small little steps. But if we don't agree to the fact that data is the future, and which can transform healthcare profoundly, I'm not sure that we will come up with solutions that have a long life to live. So finally, I wanted to talk a little bit about this application that we're building now with help from these design principles that helps us understand why we're building something, what problems we need to solve, and how we can problem. So this application is using scientific research from Karolinska Institutet and two professors called Lars Klareskog in rheumatology and Lars Alfredsson in epidemiology. And first of all, we call her Elsa. And it's a machine, of course. It's a device. It's a machine. But we've given this application a little bit of a human touch and called her Elsa. And Elsa is running a dialogue with the patient whenever something is happening. So the first time you meet Elsa is when you're onboarding, like starting this application for the first time. And she will introduce you to what kind of application this is and what this application can do for the patient and so on. And she also says that whenever I see something of interest in your data, I'm going to tell you. And it can be based on the research data that we already have and using from these professors, or it could be new data that the patient is collecting themselves. So Elsa is a guidance to help the patient understand, based on his or her own data, what's going on with him or her. And a few of the other features and functionalities in the application. So we would love for the patient to log something about their lifestyle factors every day. Because as you might be aware of, just taking a medication when you have a chronic disease, that's not it. That's not what's going to have the best outcome for you. Lifestyle factors are extremely important, and especially in RA, there is a lot of evidence that how you live your life affects the outcome of the treatment that you're getting. So what we want to log in this application is a number of symptoms of your disease, like fatigue and pain, but then we also want to log lifestyle activities, and it should be very easy to log these things. So we ask for how much you exercise, we ask for what kind of food you eat, and then we're using the Nordic nutrition recommendations to figure out whether you're eating fish or meat, etc. And we don't ask for how much, it's just getting a feeling for what this patient is eating. Do they actually eat fish 3 times per week or not? Because that might be interesting to know. We're asking for their emotional well-being, we're asking for whether they smoke or not and how much, and how their weight is going up and down, etc. And we have indexed all these activities, and in short, because this is a short speech, I'll let you know that whether you have positive activities and positive symptoms of your disease, those are corresponding with different types of green colors. And if your lifestyle activities are considered negative and you have symptoms on your disease that is not very well, they have a red color. So while the patient is using this service, we're building up a heat map where they eventually can find out if and how certain lifestyle activities are affecting the disease symptoms like fatigue and pain, which are the 2 top data points in this heat map overview. And then finally, I just also wanted to mention how we're working with a little bit of gamification and rewarding the user for using an application. So when they're doing different activities, for example, stop smoking, after 1, 14, 30, 45, 60 days and so on, we know that you have gained some different types of, well, health gains. Hälsovinster in Swedish. So based on scientific research, we know what's happening in your body after 14 days or 30 days being smoke-free. And we turn these health gains into a little trophy that you get. So every time you've received a health gain, you will also get that trophy on your profile page, and we will tell you why you get this and what has happened in your body. So we're teaching the user about their own body and their own functioning, because depending on how they're living their life and what life activities that they're taking. So final words for any of you who are working with life science or healthcare and trying to figure out what problems to solve and why and how you can solve those problems. I think that the design thinking process, where you work cross-disciplinary with people with different types of backgrounds and different types of skill sets, someone can see into the future and know about the trend and what's coming. Others know everything about technology. Some people know everything about how you find out about user needs. Some people know a lot about how healthcare is working. Those are the best teams to solve these problems. And also not forgetting that if you want an application that you want people to use for a long time, you need to reward them. You need to figure out not only taking data from them and taking information from them, what are you giving back to them? What are the health gains and what are the rewards that you want to give them? Because then you will have users that come back and use your service over and over and over. And the more people invest in your service and the data it collects, the more valuable it will become in the end. Thank you.
Thank you, Sofia. For those of you wondering about the lights, I can just inform you that this used to be Docklands, a very famous techno club. So perhaps it's a blast from the past. At least that's what I'm thinking. Any questions for Sofia?
Hello. I'm sorry, I missed the information. Who is actually the target of ELSA? Is it the patient that is already diagnosed with the disease? Or is it like everyone can use the application because they have some syndromes and they believe that they are sick?
No, it's the diagnosed The patient diagnosed with RA is the main user of the application, yes. I'm sorry for not being clear about that.
And are you planning to expand this to other diseases?
So, I mean, this is a beta, as I said. We're just making this happen, and hopefully we will release it to patients in May. And then we will study whether this is meaningful to them or not. And then we would definitely like to expand to other arthritis diagnoses and then other diagnoses outside of arthritis, where we see that we have research data on lifestyle effects and that we know that lifestyle has an effect on the treatment outcome of a certain disease. That's not true for all diseases, but for those who have that kind of context, it could be valuable.
Thank you.
Thank you.
So you are in a regulatory process then?
We will get there eventually, yes.
Because that's when it's something for curing, that's something else. That's why we keep to wellness in so many apps.
Yes.
Right, but you have the ambition to make this a medtech product.
Yes.
Good.
Thank you. It seems you are going to use, you are using also some sorts of chatbot kinds of functionalities in the apps? Or if so, then which API are you using?
So we're it's not a proper chatbot. It's a predefined dialogue to begin with. I mean, we've been working on this, developing it since January, and we want to release something in May. So it's very, very little time. We've done it very quickly, the actual programming of the application. So right now it's not that smart that I think that you might be asking about, but hopefully it will become a lot smarter. So it's kind of pre-programmed dialogues to begin with.
So as she mentioned that you will not have any kinds of problem to get approved if it's in just only in the wellness part in Sweden as an apps, as a health-related apps. For example, if you show it as it cure diseases, or then you will have some problem, right?
Well, the thing is that what we're doing right now is just explaining the lifestyle activities for the patient in a new way. So, for example, we're collecting the data, they're entering the data on their lifestyle activities and their symptoms, and we're exposing it to them in a different way, in a one kind of single view. We're not telling them to do anything in particular. They will track when they're taking the medication, for example, but we're not telling them to when they're supposed to take the medication. That is something that will come later on when we go into the whole regulation space, so to speak.
Yeah, thank you.
So it has to be simple in the beginning to just test the idea, yes.
Hi, my name is Tina Zhu from KDH. I have a question about the ELSA, for example. If the participants are not happy to see the negative data, what's your design strategy and how to increase the engagement?
So yes, you're right. I mean, there are things that you didn't see here, just a few features that I've been visualizing here. But the thing is that we think that ELSA can see a lot of interesting strikes in the data. So there will hopefully be something that is good that we can bring up, and ELSA can remind the patient of, you were able to walk more than 7,000 steps for 3 days in a row. That's great, keep it up. You need to take maybe 10,000 steps to reach the green level, because that's kind of if we take 10,000 steps per day, that is a fairly good number of steps to take, but a lot of people do not do that because we move around way too little in society today. But let's say that a patient has been able to take 7,000 for 3 days in a row. We'll cheer the patient on that and try to keep them excited about that fact that they're on the right way, even though they're not reaching kind of the green light or section yet. So there are those little features that will be built in there. I think we have a question here as well.
Thank you. So super interesting. But who is going to pay for this? Is it the patient or is it the healthcare like SLL?
The current idea is that the pharmaceutical companies will pay for it.
All right.
So thanks a lot, Sofia.
Yep. Thank you.